everyone, and welcome back to our Meet the Researcher series. My name is Holly Ninecamp, and I'm the Communications and Marketing Manager at the Canadian Liver Foundation. Today, I'm joined by Dr. Sherman. So welcome, Morris. And if you'd like to start by doing a quick introduction of yourself, that would be wonderful.
Well, as you heard, my name is Dr Sherman, and I have been a hepatologist for most of my career, and my particular interests have been in viral hepatitis and in liver cancer.
Great, that's perfect. Do you mind sharing a little bit about, where you've worked, a little bit about your history there? That would be great.
Sure. I originally trained in South Africa, and then I moved to New York for 2 years to complete a postdoctoral training. And then after that, in 1984, I moved to Toronto, and I have been at the Toronto General Hospital, now UHN, ever since then. I was part of the liver group at the hospital, and at various times I have been involved in a number of other different liver organizations, Canadian Association for Study of the Liver, the International Liver Cancer Association, and for a large number of years, I was chairman of the board of the CLF.
Great, you have a very diverse history, which is wonderful. So today we're talking about liver cancer, as it is Liver Cancer Awareness Month. So do you mind sharing some insight into liver cancer right now, in the past? Anything that you have that would be of interest to our audience would be great.
Well, liver cancer is actually one of the more common cancers in the world. It's approximately number 5 or 6 in terms of frequency of developing liver cancer, and it's about number 3 in the world in terms of causing cancer death, exceeded only by a couple of cancers such as colon cancer. And as such, it's obviously been a major target for clinical care and for research. And for many years, not much progress was made in terms of managing this condition. But I would say over the last decade, maybe even 2 decades, things have indeed changed. And we're now in a much better position to understand the disease and to offer treatments that are not always effective, but are at least effective in some individuals.
Okay, great. Yeah, I didn't realize that it was so high up there in terms of statistics. That is interesting to know.
Yeah, it's not that high in Canada. There is quite a big geographic distribution of liver cancer. But even in Canada, amongst men at any rate, it's in the top 10. But it's one of only a very small handful of cancers, of the incidence of which is increasing, not decreasing.
Okay. Do you have a little bit of insight to share on why we are seeing an increase?
The increase, well, there are a couple of factors that are operative. Some of the causes that used to be major problems back in the past are now under pretty good control, namely hepatitis B and hepatitis C. So those, as major causes, are decreasing, at least in this part of the world. In the Far East, where these diseases are more common, they are still major causes of liver cancer. But across the world, the major underlying cause at the moment is something called non-alcoholic fatty liver disease, which is a complication of diabetes, a complication of being overweight. And all of these causes, viral hepatitis and these other causes, lead to inflammation in the liver, lead to scarring in the liver, and this ultimately leads to cirrhosis. And this is the background on which liver cancer develops. It is pretty uncommon for it to develop in a normal liver.
Okay, very interesting. Thank you for sharing that. I know I went a little bit off with that question, but I appreciate you providing that insight. So thank you. Do you want to give us a little bit of insight into the importance of liver cancer research? Maybe you could share, some present research that you're aware of going on. That would be perfect.
I guess there are three or four targets of research in liver cancer. First of all, the most important is being prevention. And so hepatitis B vaccination, control of hepatitis B in those who are infected with that virus, and treatment of hepatitis C are all major factors in the prevention of liver cancer. In terms of the diabetes and the non-alcoholic fatty liver disease, those are much harder to deal with from a prevention point of view because really they involve lifestyle changes, which are very hard to implement. The same applies for alcoholic liver disease. It requires a lifestyle change that is hard to implement. So primary prevention is certainly ongoing with regard to the viral hepatitis causes, but also these other factors, at least in some places in the world, governments are starting to address these issues, such as food labeling and so on. So that's the primary. The secondary objective would be to detect the cancer early at a treatable stage. Unfortunately, this is one of those cancers that grows silently until it's very late. And so if you miss it early, the chances are it's not going to be cured. So there are a number of techniques that can be used to screen patients for liver cancer. Obviously, you're not going to screen the whole population, but you're going to screen those in whom you can identify a risk. And there are a number of schemes to assist in identifying who's at risk. And once those people have been identified, mostly by way of blood tests, then there's the intervention to screen for cancer itself. And again, this is mostly blood tests, although the 6-monthly ultrasound in patients with cirrhosis is another very important way of attempting to address the screening part of the equation. In terms of research, many of these techniques for identifying people at risk and for providing screening techniques are, shall we say, clinical opinion rather than established research that is unequivocal. So as a result, there are lots of different strategies, and which is the best strategy, which is the most effective, is not clear, and that is one of the targets for research in secondary prevention. Then, of course, the tertiary aspect would be treating the cancer itself. And so, again, this can be divided into two separate phases, the early cancer and the late cancer. So the early cancers are treated by interventions that are not drug-related. So there's a technique called radiofrequency ablation, where what they do is if there's a small, say, less than 3 centimeter lesion in the liver, they would insert a needle. The tip of the needle gets hot, and essentially it cooks the tumor from inside. It coagulates it, like boiling an egg. And that is very effective in small cancers, although sometimes small cancers are larger than you can see on X-ray. Other treatments include surgery. If the cancer is too big for this radiofrequency ablation, there's the possibility of surgery. And then for larger cancers, there's radiotherapy. There's something called chemoembolization, which is a way of delivering chemotherapy directly at the cancer, as opposed to putting it in a peripheral vein. And then finally, there is drug treatment of more advanced cancers. But the problem with all of these treatments is that they are limited to some extent by the ability of the liver to function normally. And in patients with cirrhosis, this is often a problem because the cirrhosis inhibits normal liver function. And sometimes it inhibits normal liver function to the extent that the preferred treatment cannot be offered. For example, if you have a bad liver, you cannot remove half of the liver to remove a tumor because the patient will not survive the surgery, never mind surviving the cancer. So that is a big problem in terms of managing liver cancer, and that's one of the other reasons why it's preferable to catch these things small, because the damage to the surrounding liver that comes from the treatment is more limited. So There's research, a lot of research recently into finding better chemical treatments. But really, those are treatments of late stage disease. The biggest bang for the buck is going to come from treating early stage disease.
Okay. If you don't mind me asking, if you could touch a little bit on how an individual might go about understanding if they potentially have liver cancer. Like, would you say if they've been diagnosed with cirrhosis, is that something that they need to be working with their healthcare team to monitor its progression?
Absolutely. I mean, amongst the people who make the clinical opinions, it is widely regarded that anybody who has cirrhosis needs to be screened for liver cancer because it's a silent condition. It's not going to call attention to itself until it's too late. So in North America and in the Western world, and in a good part of the Asian world, the Eastern world, ultrasound forms part of the screening technique. And in fact, in North America, it's the major way that screening is done, is with an ultrasound every 6 months.
Okay.
But I think you can back up a little bit further. And the question is, okay, so if you've got cirrhosis, everybody knows that there's a risk. But the bigger question is, if you have liver disease, do you have cirrhosis? Because cirrhosis is also silent. And so there are, I mentioned some of the risk scores that have been used to identify risk. Those are mostly applicable to people who already have cirrhosis. And they are used primarily to exclude people from screening because the risk is so low, even though they have cirrhosis, that they don't need it. More important, well, maybe not more important, but equally important, is to check if you have some kind of liver disease, firstly, and then if you have liver disease, do you or do you not have cirrhosis? So to check for liver disease are simple blood tests. There's something called the ALT. If the ALT is normal, you likely do not have liver disease. If the ALT is not normal, even if it's only slightly high, the chances are you have some form of liver inflammation. Because ALT, the test, is a marker of liver inflammation. So that should be done as part of the routine blood tests that family doctors do every year or every 2 years. And particularly in patients who are overweight or patients who have diabetes, those are important tests to do. So then let's assume that somebody has been diagnosed with liver disease. The next step is to assess whether they have cirrhosis or not. And again, there's a panel of blood tests that can be used, actually several different panels of blood tests that can be used. But perhaps the most reliable is something called a FibroScan, which is a form of ultrasound, which is done in any doctor's office. You don't need ultrasound training for it. At the moment, I'm not sure if it's reimbursed in every province. I think it's reimbursed in Ontario. I'm not 100% certain of that. But that would be the most reliable way of detecting not only do you have cirrhosis or not, but how much scarring you have. It gives a gradation of scarring from nothing to cirrhosis to bad cirrhosis. And so you can see where you are on that spectrum and, if necessary, make lifestyle changes to try and halt the process.
Okay, that's great. Yeah, you've shared some really good insights there, and I think some good takeaways for members of our community who, might want to contact their healthcare team if they think they might be at risk. Thank you for sharing that. Just a couple more questions.
Yeah.
What excites you most about the research and progress being made in your fields of expertise and in the broader study of liver disease?
I think what I'm most excited about is that there is more and more rigor being applied to classifying liver disease and stages of liver disease, because it's kind of been a one-size-fits-all for many categories of liver disease, and now we're able to more precisely define smaller categories, and it might then be easier to apply an intervention. Not more easy, but you can be more directed with your intervention. So, for example, let's take acute on chronic liver failure. We used to talk about liver decompensation. Now we know that, yes, there's some people who simply slowly progress and deteriorate, but there are others who are stable, and then something happens, like they get an infection and they get an acute on chronic flare. And when they go back, when the flare is over, they don't go back to their previous level. They go back to a somewhat lower level. And so those kinds of insights are helpful in terms of thinking about how we should approach this. So that's one of the things that excites me quite a lot about liver disease in general. About liver cancer specifically, I think that one of the, we talked previously about prevention, primary prevention, secondary prevention, and screening. Screening at the moment is useful for some people, but it's not perfect by any means. But there are investigations underway to improve screening, particularly the use of what they call cell-free DNA, which is, it's not tissue, it's from the blood. So first of all, it's easy to collect. It's not like needing a biopsy. But secondly, what they do is they look at the state of the DNA and certain factors of the genetic material that's circulating in the blood. And these are abnormal in a variety of different cancers. And this is probably true for liver cancer as well. And these tests are very sensitive. We're not quite sure how specific they are. In other words, do they pick up things other than liver cancer? They certainly pick up a lot of liver cancers, but do they pick up other things, too many other things to make them worthwhile? So that to me is an exciting area, and hopefully that pans out.
Yeah, definitely. That sounds like it has great potential. So that's exciting to hear. Last question for you. It's kind of a fun one. So if you were to, choose a different career unrelated to the one that you're currently pursuing and have pursued, what would that be?
You're going to laugh at this. I would be a game ranger in Africa.
Oh, wow. That's interesting. Any reason why?
Well, I grew up in South Africa, and we loved going to the game reserves. And since I've moved to North America, we've been back a number of times to the game reserve, and I feel at home there. I really enjoy it. And I know now, I didn't know back then, I know now that lots of very serious research goes on in these game reserves and game parks across Africa. And I would love to be part of that.
Sounds very interesting as well. Maybe in another life. You never know.
Yeah, hopefully.
Yeah, well, thank you so much for taking the time to chat with me today. Is there any final thoughts you'd like to leave before we sign off?
Yeah, just the one thing is liver disease is common, right? Fatty liver disease in the United States is more than 30% of the population, and here it's about 25 to 28%. So it's very common, and really, because it's so common, everybody should be checked for it.
Okay, yeah, that's some great words of wisdom, and definitely we're seeing and hearing from people in the community who have, it's new to them. So, but it's not so. Like you're saying, it's common. So that's great to hear you say that as well. So thank you so much for your time.
Well, you're welcome.
Thank you for joining us.
Okay. Bye.
Bye.